The silent crisis, how private habits are quietly damaging men over 60. It was a Tuesday afternoon when Harold, a 72-year-old retired engineer, walked into my office with a look of quiet desperation I'd seen countless times before. His words still echo in my mind. "Doc, I've been doing it the same way for 50 years, but lately something feels wrong." Harold wasn't experiencing any obvious illness. His blood pressure was stable, his medications unchanged, his recent physical exam had shown nothing alarming. Yet something was quietly damaging his body in ways that wouldn't show up on standard tests. Something that was affecting his heart, his prostate, and even his fundamental ability to feel pleasure and connection. The culprit? Masturbation. Not the act itself, which remains a natural and healthy part of human sexuality throughout life, but the way Harold and millions of men like him had been approaching it for decades without realizing the cumulative harm they were causing. I'm Dr. Robbin, and in my 6 decades as a urologist, I've dedicated my career to helping men over 60 maintain their strength, circulation, and confidence without shame, unnecessary medications, or guesswork. What I've discovered through thousands of consultations is that while society has told us that masturbation is universally healthy, the reality is more nuanced. After 60, some private habits that once served us well can quietly become harmful, often without a single warning sign, until the damage is already significant. The statistics are sobering. Studies show that up to 78% of men over 60 experience some form of sexual dysfunction, yet fewer than 30% seek help. Many assume it's simply part of aging, but my clinical experience tells a different story. Often, it's not age itself causing the problem, it's decades of well-intentioned but ultimately harmful habits that compound over time. In this comprehensive guide, I'll reveal the 7 most critical mistakes older men make during masturbation and provide detailed solutions to address them before they irreversibly affect your energy, performance, and long-term health. Mistake number 6, which I'll discuss in detail, is perhaps the most damaging and the one that almost every man gets wrong. The foundation, understanding the aging male body. Before we explore these mistakes, it's crucial to understand how the male body changes after 60. Your cardiovascular system becomes less efficient, requiring more time and care to achieve adequate blood flow. Your nervous system, while still capable of profound sensation, becomes more sensitive to pressure and trauma. Your hormonal landscape shifts, with testosterone levels naturally declining and the delicate balance of neurotransmitters like dopamine becoming more fragile. These changes don't make you broken, they make you different, and different requires different approaches. Mistake 1, using pornography as the primary stimulus, the dopamine disaster. Over the years, I've had countless consultations with men, usually in their late 60s or early 70s, who sit across from my desk with the same quiet, almost embarrassed concern. "Doctor," they often begin, their voice is barely above a whisper. "I can't seem to feel much anymore. It's like my body's going numb, and I don't know why. My wife tries, I try, but it's just different, flat, empty." The conversation that follows is always delicate, but I've learned to ask one simple, direct question. How often do you rely on pornography for arousal? Almost invariably, their eyes drop, not because they're ashamed, but because they never realized this habit might be causing real harm. The science of overstimulation. When you're over 60, your brain's dopamine system, the complex network responsible for pleasure, motivation, and reward, is no longer as sharp or flexible as it was in your youth. This isn't a defect, it's a natural part of aging. However, this biological reality makes older men particularly vulnerable to what I call stimulus inflation. Modern pornography, with its endless variety, high-speed editing, and extreme content, floods the aging brain with more stimulation than it was ever designed to handle. When you consume this content day after day, week after week, your brain adapts in the worst possible way. It begins to numb itself as a protective mechanism. The neurological process is both fascinating and tragic. Your dopamine receptors, overwhelmed by the artificial intensity, become less sensitive. This means that the very thing you once enjoyed, the real, natural spark of intimacy with a partner, or even the simple pleasure of your own touch, starts to fade into a gray mediocrity. The cascade of consequences. Effects extend far beyond sexual function. Men who rely heavily on pornography often report emotional disconnection. Real intimacy feels flat or boring compared to the artificial intensity of pornography. Performance anxiety. The gap between fantasy and reality creates pressure and stress. Relationship strain. Partners may sense the emotional distance, leading to conflicts and misunderstandings. Physical desensitization. Touch doesn't feel the same. The body responds more slowly and less intensely. Motivation decline. The dopamine dysfunction can affect drive and enthusiasm in other areas of life. The recovery path. The good news is that the brain retains remarkable plasticity, even in later years. Recovery requires what I call a neurological reset, gradual reduction, immediately stopping all pornography use, cold turkey approach. Mindfulness integration, learning to focus on physical sensations rather than visual stimuli. Partner communication, if you're in a relationship, honest conversation about the changes you're making. Patience and understanding that sensitivity can return, but it often takes 3-6 months of consistent change. One of my patients, Robert, 68-year-old teacher, described his recovery. It was like slowly turning up the volume on life again. Things I hadn't noticed, my wife's touch, even the feeling of a warm shower, started coming back into focus. Mistake 2, masturbating while sitting on the toilet, the circulation catastrophe. This mistake might sound almost comically harmless at first, perhaps even practical. Over the years, I've spoken with hundreds of older men who admit, often with a sheepish grin, that the bathroom has become their primary space for self-pleasure. It's private, it's convenient, no one interrupts, the door locks, and cleanup is simple. But what these men don't realize is that this seemingly innocent choice of location is causing far more damage than they could imagine. The anatomy of harm. As men age, circulation becomes one of the most critical systems to protect and preserve. Blood flow is literally the foundation of healthy sexual function, prostate wellness, cardiovascular health, and your ability to recover after climax. The pelvic region, in particular, relies on unimpeded circulation to function optimally. Sitting for extended periods, especially in the hunched over, compressed position many men naturally adopt on the toilet, creates a perfect storm of circulatory problems. Arterial compression, the angle of the hips and thighs compresses major arteries supplying the pelvic region. Venous pooling, blood struggles to return from the genitals and pelvic floor, leading to congestion. Prostatic pressure, direct pressure on the prostate gland, which is already enlarged in most men over 60. Nerve compression, the pudendal nerve, crucial for sexual sensation, becomes compressed. The clinical evidence. In my practice, I've documented a clear pattern. Men who regularly masturbate while sitting, particularly on the toilet, develop a constellation of symptoms that often appear gradually. Post-urination dribbling, difficulty fully emptying the bladder, pelvic aching, vague discomfort in the groin, lower abdomen, or perineum, erectile dysfunction, reduced rigidity and difficulty maintaining erections, reduced sensation, numbness, or decreased sensitivity during arousal. Prostate inflammation, chronic prostatitis symptoms that seem to have no clear cause. James, a 71-year-old retired mechanic, came to me with complaints of urinary hesitancy and pelvic pain. After 3 months of changing his habits, standing instead of sitting during self-pleasure, his symptoms improved dramatically. I never connected the dots, he told me, but it makes perfect sense now. The solution, environmental awareness. The fix isn't complicated, but it requires mindful change. Standing position allows gravity to assist circulation rather than fighting it. Reclining option. If standing isn't comfortable, a reclined position on a bed maintains better blood flow. Time limits, even in optimal positions, avoid extended sessions that might impede circulation. Movement breaks. If the process takes time, incorporate gentle movement or position changes. Mistake 3, rushing the experience, the urgency trap. In our youth, sexual experiences often happen quickly, intense, urgent, focused on the destination rather than the journey. This approach can work well when the body is resilient and responsive. But after 60, rushing becomes not just counterproductive, but actively harmful. The psychology of rushing. I've observed that older men rush through self-pleasure for several complex reasons. Lifetime conditioning, decades of quick, quiet encounters to avoid detection. Shame or guilt, feeling that the activity should be minimized or gotten over with. Physical discomfort, arthritis or other conditions making sustained activity uncomfortable. Fear of discovery, even in private, old habits of secrecy persist. Performance anxiety, worry that arousal might fade if not acted upon quickly. The physiological cost. When you rush, you activate your sympathetic nervous system, the body's stress response. This creates a cascade of problems. Cardiovascular stress, heart rate spikes quickly, blood pressure rises, and blood vessels constrict rather than dilate. This is particularly dangerous for men with existing heart conditions. Hormonal disruption, the beneficial hormones released during sexual activity, oxytocin, endorphins, prolactin, require time to reach optimal levels. Rushing short circuits this process. Muscular tension, the pelvic floor and surrounding muscles tense up, reducing blood flow and sensation. Neurological confusion, the nervous system receives mixed signals about pleasure and stress, leading to diminished sensitivity over time. The mindful alternative, learning to slow down transforms the entire experience. Breathing focus, deep, slow breathing activates the parasympathetic nervous system. Sensory awareness, paying attention to different textures, temperatures, and sensations. Progressive arousal, allowing arousal to build, slowly plateau and build again. Mindful presence, staying focused on the current moment rather than rushing toward climax. Dr. Barry Komisaruk's research at Rutgers University has shown that mindful, slower sexual practices actually increase neuroplasticity and can improve overall brain health in older adults. Mistake 4, ignoring the pelvic floor, the hidden foundation. Most men have never heard of the pelvic floor, yet it's arguably one of the most crucial muscle groups in the male body, especially after 60. This complex network of muscles forms the foundation beneath your bladder, prostate, and sexual organs. The hidden engine that powers everything from erections to orgasms to urinary control. Understanding pelvic floor anatomy. The male pelvic floor consists of several interconnected muscle groups. Levator ani, the largest group supporting pelvic organs. Coccygeus, stabilizing the pelvis and supporting the spine. External anal sphincter, controlling bowel function. Bobospongiosus and ischiocavernosus, directly involved in erection and ejaculation. These muscles work together to create what urologists call the sexual symphony, coordinated contractions that enhance pleasure, control ejaculation, and maintain erectile rigidity. The consequences of neglect. When the pelvic floor weakens or becomes uncoordinated, every aspect of sexual and urinary function suffers. Sexual dysfunction, weak pelvic floor muscles can't maintain sufficient blood pressure in the penis, leading to poor erections. They also can't contract properly during orgasm, reducing intensity and satisfaction. Urinary problems. These muscles help control the flow of urine. Weakness leads to leaking, dribbling, and incomplete bladder emptying. Premature ejaculation or delayed ejaculation, an uncoordinated pelvic floor can cause either condition depending on whether the muscles are too tight or too loose. Chronic pain, tension or weakness in these muscles can cause persistent pelvic pain, back pain, and hip problems. The restoration process. Reactivating the pelvic floor requires patience and consistency. Identification, learning to isolate and feel these muscles, the same ones used to stop urination midstream. Progressive strengthening, starting with gentle contractions and gradually building endurance. Coordination, training, learning to coordinate these muscles with breathing and arousal. Integration, incorporating pelvic floor awareness into sexual activity. Arnold Kegel, who first popularized pelvic floor exercises, found that men who consistently practiced these exercises showed improvement in sexual function within 6-12 weeks. The frequency, that's too high or too low, finding the sweet spot. The question of frequency is perhaps the most anxiety-provoking aspect of male sexuality after 60. Men worry they're doing it too often or fear they've gone too long without. The truth is, both extremes can cause significant harm. The dangers of excess. When masturbation becomes compulsive or overly frequent, several problems emerge. Physical exhaustion. The body's recovery systems become overwhelmed. Energy levels drop, sleep quality deteriorates, and overall vitality decreases. Prostatic irritation. Frequent ejaculation can inflame prostate tissue, especially if it's already enlarged. This can worsen urinary symptoms and increase infection risk. Neurological dulling. The nervous system becomes accustomed to frequent stimulation and requires more intensity to achieve the same response. Relationship impact. Interest in partner intimacy often decreases when solo activity is too frequent. Hormonal imbalance. Testosterone levels can fluctuate inappropriately, affecting mood, energy, and overall health. The risks of abstinence. At the other extreme, complete abstinence creates its own problems.
Use it or lose it principle. Sexual tissues require regular blood flow to remain healthy. Without it, atrophy begins within weeks. Hepatic stagnation. The prostate needs regular emptying to prevent bacterial buildup and maintain health. Psychological effects. Complete sexual abstinence can lead to depression, anxiety, and loss of confidence. Relationship strain. Partners may interpret lack of sexual interest as rejection or loss of attraction. Finding your personal frequency.
Research suggests that for most men over 60, the optimal frequency is 1-2 times per week, but individual variation is significant. Factors to consider include overall health status, medication effects, stress levels, relationship dynamics, personal history and preferences. The key is listening to your body's signals and adjusting accordingly. Mistake 6, using too much pressure or force, the sensitivity destroyer. This is perhaps the most overlooked yet damaging mistake I encounter in my practice. Countless patients have sat across from me, frustrated and confused, saying things like, "Doc, I don't feel as much as I used to," or "It's taking more and more effort to get anywhere." Behind these complaints often lies one silent habit they've never questioned: using excessive pressure during self-stimulation. The vicious cycle. As natural sensitivity decreases with age, the instinctive response is to compensate with more intensity. Men grip tighter, press harder, or use rougher surfaces in an attempt to recreate lost sensations. But this approach creates a devastating cycle. More pressure, tissue damage, less sensitivity, even more pressure needed, greater damage. The physical damage. The penile tissue is remarkably delicate, especially in older men. Years of excessive force can cause microtrauma, tiny tears in blood vessels and nerve endings that heal with scar tissue. Peyronie's disease, development of fibrous plaques that can cause curvature and pain. Reduced elasticity, loss of the tissue's ability to expand and contract normally. Nerve damage, permanent reduction in sensitivity from damaged nerve endings.
Vascular problems, scarring of blood vessels that impairs erection quality.
The psychological component. Beyond physical damage, excessive force creates psychological problems. Disconnection from pleasure. When pleasure requires work, it becomes a struggle rather than enjoyment. Performance anxiety, fear that normal stimulation won't be enough. Partner difficulties. The intensity required for solo pleasure may be impossible to recreate with a partner. The gentle revolution. Recovery requires a complete shift in approach. Pressure reduction, using minimal pressure, focusing on movement rather than grip. Lubrication, always using adequate lubrication to reduce friction. Variety, exploring different touches, speeds, and techniques. Patience, accepting that sensitivity may take months to return. Professional help, considering therapy if the problem is severe. Mistake 7, masturbating without emotion, connection, or intention, the spiritual dimension. This final mistake cuts to the heart of what makes sexuality truly fulfilling, the integration of physical pleasure with emotional and spiritual connection. Many older men gradually slide into treating self-pleasure as a purely mechanical act, a biological function divorced from meaning, emotion, or intention. The disconnection epidemic. In my decades of practice, I've witnessed a troubling trend. Men describe their sexual experiences using words like routine, going through the motions. Again, it's done. A mechanical,
This emotional disconnection has profound consequences that extend far beyond the bedroom.
The neurochemical reality. When sexual activity is emotionally connected, the brain releases a complex cocktail of beneficial chemicals. Oxytocin, the bonding hormone that promotes feelings of connection and well-being. Endorphins, natural painkillers that improve mood and reduce stress. Prolactin promotes feelings of satisfaction and relaxation. Dopamine, when released appropriately, enhances motivation and pleasure. Serotonin stabilizes mood and promotes feelings of contentment. When masturbation is mechanical and disconnected, these beneficial chemicals are released in much smaller quantities, if at all. The mindful transformation, transforming solo sexuality into a mindful, connected experience, involves intention setting, beginning each experience with a clear, positive intention. Gratitude practice, appreciating your body's capacity for pleasure even as it changes. Emotional awareness, noticing and honoring whatever emotions arise. Breathing connection, using breath to stay present and connected. Body appreciation, viewing the experience as self-care rather than self-indulgence. The spiritual dimension. Many spiritual traditions recognize sexuality as a sacred aspect of human experience. This doesn't require religious belief, but rather an appreciation for the profound capacity for pleasure, connection, and transcendence that sexuality can provide, even in solitude. The integration, your path forward. Understanding these 7 mistakes is just the beginning. True transformation comes from integrating this knowledge into a comprehensive approach to sexual health and well-being. Creating your personal protocol. Based on my clinical experience, here's a framework for developing your own healthy approach. Weekly assessment. Check in with your body, energy levels, and emotional state. Environmental optimization. Ensure your space supports relaxation and circulation. Mindful preparation. Take time to transition from daily stress to sensual awareness.
Technique variety. Experiment with different approaches, pressures, and rhythms. Recovery attention. Notice how you feel afterward and adjust accordingly. The bigger picture, your body is still speaking. Your body is still talking to you, even if its voice has changed. It speaks through different signals now, perhaps more quietly, more slowly, but no less meaningfully. The key is learning this new language of sensation, emotion, and connection. Professional support. Don't hesitate to seek professional help when needed. Medical evaluation. Rule out underlying conditions that might be contributing to problems. Psychological counseling. Address emotional or psychological barriers. Physical therapy. Work with specialists in pelvic floor rehabilitation. Sexual therapy. Learn new techniques and approaches with trained professionals. The long view. Remember that sexual health is not separate from overall health. The same factors that support your cardiovascular system, your mental health, and your relationships also support your sexual well-being. Regular exercise, stress management, quality sleep, nutritious diet, strong relationships, meaningful activities. Continued learning and growth. Conclusion, reclaiming your quiet power. At the end of the day, this isn't just about avoiding mistakes or even improving sexual function. It's about reclaiming the quiet power that's still within you, the capacity for pleasure, connection, and vitality that doesn't diminish with age, but rather deepens and becomes more precious. Your best years are not behind you. They exist in how you choose to live this next chapter. With care, with wisdom, with respect for your body's changing needs, and with appreciation for the profound gift of embodied existence. The 7 mistakes we've explored, over-reliance on pornography, poor positioning, rushing, neglecting the pelvic floor, inappropriate frequency, excessive force, and emotional disconnection, all share one common thread. They represent disconnection from your body's wisdom. Your path forward is one of reconnection to sensation, to emotion, to the quiet dignity of aging well. This reconnection takes patience, practice, and self-compassion. But I promise you, from 6 decades of helping men navigate these challenges, the capacity for transformation, pleasure, and connection remains within you, waiting to be rediscovered and honored. Take what you've learned here, apply it gently with patience and self-compassion, and remember, your body is still yours, it still feels, and it still matters. The conversation between you and your body is far from over. It's simply entering a new, potentially richer chapter. Your health, your pleasure, and your dignity are worth this investment. You are worth this investment. The quiet power within you is still there, waiting to be reclaimed, with wisdom, care, and the deep respect you deserve.